Knock knock. I'm closing the door for privacy and I'm doing hand hygiene. My name is Fadet and I will be your student nurse today. So
Okay.
hand hygiene. Let me put a pair of gloves on.
Mm-hmm.
May I please have your first and last name?
Boy Dubois.
Boy Dubois.
Mm-hmm.
Can I have your date of birth?
Date of birth is 12/5. I don't remember.
0430.
Yes, 0430. I meant to say.
Do you have any allergy?
Yes, I'm allergic to shellfish.
You're allergic to shellfish.
Mhm.
Do you have any reaction to it? What reaction do you have?
Hives.
Hives.
Yes.
Okay. And I have MRN number 7727893. And I also see you have an allergy bin right here.
Mm-hmm.
That's why you're allergic to shellfish.
Mm-hmm.
Mr. DuBois, I'm here to do a head to toe on you, okay?
Yes.
Alright, I'm gonna start with a set of vitals.
Mm-hmm.
I have blood pressure 130/72.
Mm-hmm.
I have oil temperature. I have 99.4. I have heart rate 75. And I'm gonna check for respiration for 1 full minute and it's 22.
Mm-hmm.
I have O2 97% warm air. Mr. DeBoer, do you have any pain?
Yes, I do.
Where is it located at?
On my right hip where I had my surgery.
In your right hip.
Mm-hmm.
Okay, on a scale of from 0 to 10, what is your pain level?
3.
Oh, 3.
Mm-hmm.
Does it radiate anywhere?
It's just on my no, it's not weighted. It's just on my right side.
What does your pain feel like? Is it sharp or
I think
dull?
it is sharp.
It's sharp.
Mm-hmm.
What make it worse?
Worse with movement.
Worse with movement. What make it better?
Better with pain medication. Actually, I could use a little extra something to take the last bit of pain away for a little while to get some rest.
Okay, I see you have Tylenol PRN for meds
Mm-hmm.
for pain over 3, and I'm gonna administer that to you right after I'm done with your head to toe. Okay.
Okay.
All right, Mr. DeBoer, do you know where you're at right now?
I'm at Fortis Hospital.
Do you know why you're here?
Yes. I'm here for osteoarthritis and hip surgery.
Okay. Do you know what today's date is?
Today is 10/22/2020.
10/23.
2023.
Okay. Okay. While patient is alert and oriented, I will say times 3.
Time 4. I
Times
know
4.
the date. I just.
Okay, Mr. DeBoer, I'm gonna start. I'm gonna look inside your pupil,
Mm-hmm.
and I'm gonna look at both.
Okay.
They're round, equal, and we are take 2 live. Perla is present. I'm gonna check for accommodation.
Mm-hmm.
Just look straight ahead of my pen in accommodation.
Mhm.
Okay. And now I'm gonna look inside your mouth.
Mm-hmm.
It's pink, moist, and everything look intact. Mr. DeBoer, do you have any cough?
Yes.
Is it productive or
Yes, it is
non-productive?
productive.
What is the color of your sputum?
It is white.
White. Is it thick or thin?
It is a 10.
It's thin. Okay. If I give you a little cup, that's like 30 ml. Would you fill it up?
5.
About 5.
Mhm.
Okay. Let me pull down your gown. I'm gonna check for skin. Okay, it's non-tinting, and I'm also gonna inspect for chest symmetry. Your chest looks symmetry. I'm gonna check and skin is warm to touch and skin look appropriate for ethnicity. No sign of any lesion. It look intact. And also, and now I'm gonna listen to your lung sound. Okay. I'm gonna listen to 8 spot up front and 8 spot in the back, and I'm gonna do the zigzag modification. 1, 2, 3, 4, 5, 6, 7, and 8. I listen to 8 spot up front, and I will listen to 10 spot in the back, and all lung field were clear. And while I'm here, I'm also gonna listen to your heart, and I'm gonna start on your second intercostal on your right for your aortic valve, and second intercostal on your left for your pulmonic valve, third intercostal on your left for your Erb's point, and fourth intercostal on your left for your tricuspid, and fifth intercostal midclavicular on your left for your mitral valve, and and I hear S1, S2. And I'm also gonna listen for your apical pulse for 1 full minute. And 1 minute is up. Apical pulse is 84. And I didn't hear any extra hot sound or murmurs. Okay. And I am looking at respiration. The on label, regular weight and rhythm. And they're regular. Okay, and I'm gonna check for your pulses. I'm gonna check for your brachial pulse, and it's +2. I'm gonna check for your radial pulse, and it's +2. And while I'm here, I'm gonna look for your IV site. The IV site doesn't look no redness, no swelling, no infiltration. And there's date on the IV, today's date, and it look intact. And I'm gonna flush it whenever if I have to give you any IV med.
Okay.
And now I'm gonna check for capillary refill. Okay, less than 3 seconds. Now I'm gonna check for strength up upper extremity strength. I'm gonna push +5. I'm gonna pull +5, and now I'm gonna have you squeeze my hand, and it's +5. And now I'm gonna let me inspect your abdomen. Your abdomen, it look like you do have a JP joint on your right hip. And there is a dressing, and it have a little bit of blood on it, serous sanguineous blood. It look red. But the dressing look intact. No, the dressing have a date on it, but it have a little bit of blood in it. I'm gonna check to see if you need a dressing change, but I have to call the doctor and talk to the doctor about that, since that might be your first dressing change, so the doctor can see it. But the JP drain doesn't look like it have a large amount on it, so I'm gonna leave it alone. But once it start filling up, I will empty it and change and kind of like see the amount of the blood that you putting out. And I'm inspecting the abdomen. The abdomen look flat, symmetry, no bulge or any mass visible. And now I'm gonna auscultate to listen to your bowel sound. I'm gonna start on your right lower quadrant. Bowel sound heard. Right upper quadrant. Bowel sound heard. Left upper quadrant, bowel sound heard, and left lower quadrant, and bowel sound heard. And now I'm gonna palpate. I'm gonna try not to go where you're hurting. I'm gonna start on right lower quadrant. Tell me if you feel any pain or tenderness. Pain or tenderness, and pain or tenderness, pain or tenderness, no pain or tenderness, and I didn't feel any mass or anything like that. Mr. DuBois, I understand that you in a ice-chip diet. That was the last thing you had before your surgery, right?
Yes.
Okay, and we're gonna check with the doctor after they check your gag reflex to see if you're ready for you to have anything to drink or anything. And we're gonna try to, whenever I call the doctor, I'm gonna check to see when you're able to eat again, okay?
Okay.
Alrighty. And now let me look at your genitalia. I'm gonna inspect. I don't see any sign of lesion, sore, edema, or any sign of discharge, and no abnormalities. Everything look intact. Mr. DuBois, when was the last time you urinate?
It was before the surgery.
Before the surgery? Do you remember what was the color of it?
It was yellow.
Did it have any odor to it?
No.
No odor. What was the clarity of it? Clear
It was
or cloud?
clear.
Clear. Was it a little bit or a large amount?
It was a small amount,
Small
about
amount?
150.
Okay. When you have to go, do you feel any pain?
No, I don't have no pain.
Any urgency?
No urgency.
How frequently do you go?
I have decreased frequency.
Decreased frequency. I'm gonna talk to the doctor about that also to see what they can do for you. When was the last time you had a bowel movement?
I would say it was like before surgery.
Before
this morning,
surgery?
yeah.
What was the color of it?
It was brown.
Did it have any special odor to it?
No, not really.
What was the consistency of it?
It was form.
Was it a large or a small amount?
It was a medium amount.
Medium amount? Okay. And now I'm gonna cover you up. Now I'm gonna look at your legs. I understand that you have a abducted pillow. I'm gonna make sure that it's correct. Do you feel comfortable? Are you feeling uncomfortable with the pillow?
Yeah.
It's
No,
okay.
I do feel comfortable.
Okay, it's okay. Alrighty. And I'm gonna check for your legs. I'm gonna check for edema. I don't see any edema present, no edema. And now I'm gonna check for your lower extremity pulses. I'm gonna check for your posterior tibial, and it was plus at it was actually +2, and dorsalis pedis +2, and I'm gonna check for strength. I'm gonna push, and you got +3 in your left legs and +5 in your right legs, and I'm gonna pull, and you have +3 on your right legs and +5 in your left legs. And now let me remove my glove. Gonna do some hand hygiene. All right, let me cover you up, Mr. DeBoy. I understand you just had surgery. I see you have incentive sporameter right next to you for you to use. I would suggest that you use it at least 10 times in an hour to help expand your lungs, especially right after surgery. It's a very good idea, so it can prevent you from getting any complications such as pneumonia, because it's gonna expand your lungs. It's gonna make it healthy. I don't know if you know how to use it, but I can demonstrate it for you. I will have you put it sit up upright if you can. If you can't, you can get someone to help you since you just had surgery. Try to sit up. I will have you put it inside your mouth. Put it tightly around your mouth, and then you're gonna inhale. You're gonna inhale kind of like you're smelling the roses, and then until you see the little balls go as high as you can. Okay, and hold it for 10 seconds. And then take it out, and then you're gonna breathe out. You're gonna exhale, like you're gonna kind of like inhale first, hold it, and then exhale, and you blow like you blowing out. And then try to do that at least 10 times in an hour, or if you're watching TV, whenever you're watching TV, whenever like the commercial come on. Also, I would suggest, I see that you can get up to ambulate beds. I look in your chart, they said that you can ambulate with physical therapy. I would suggest that I will encourage you to ambulate whenever you can. We will make sure that you get the pain medication before you ambulate, so it can help you ambulate and move around so you don't have any blood clot forming. Also do some deep breathing and exercise to help you relax. Some guided imaginary, like kind of like imagine that you looking at some pleasant something pleasant, so it can help you with the pain, so you don't have to get like pain medication all the time. Okay,
Okay, thank
do you have any questions for me?
No, that will be all. Thank you so much.
Okay, alrighty. I'm gonna leave you alone, and I'm gonna call the doctor and let the doctor know all the findings. And now I'm gonna make sure their bed is at its lowest position, and it's locked, and side wells are up, and you have your call lights right next to you. If you need anything, since you just had hip surgery, do not get up by yourself. Call us if you need anything, and I have your table right next to you with everything you need. I'm gonna leave. You want the door open or closed?
You can leave it closed for me, please.
I'll close it, and I'm gonna do hand hygiene. I'll see you later, Mr. DeBoy.
Okay, thank you.
Alrighty.